They found him sitting motionless, his hands resting gently on the armrests of his favorite chair. The sun had gone down, the news still playing on low volume, and yet he was gone. No pain, no trauma, no struggle, just gone. The coroner called it natural causes. But in my line of work, I see a different truth, a truth that's uncomfortable, silent, and far more common than most people realize. What ended his life wasn't just aging. It was the invisible erosion of his masculinity, his hormones, his vitality, caused by a complete shutdown of intimacy. Not from illness, from misunderstanding. Every year, tens of thousands of men over 60 silently slip into this exact kind of decline. Their strength fades, their mood darkens, their sexual function weakens, and they chalk it all up to getting old. But what if I told you that many of these symptoms aren't just natural, that they're actually avoidable consequences of something men have been taught to give up? I'm talking about masturbation. Yes, solo intimacy. For decades, men have been conditioned to view it as childish, shameful, or unnecessary. But after age 60, that belief doesn't protect you, it harms you. You see, when an older man stops masturbating altogether, his body doesn't just take a break. It begins to shut systems down. Your prostate slows. Your testosterone begins to plummet. Your emotional strength thins out. And by the time the signs become noticeable, the damage is already several years deep. My name is Dr. Sophia Jain. I'm a board-certified urologist with over 3 decades of experience helping men protect their health and reclaim their vitality. I've worked with retired engineers, war veterans, former athletes, and blue-collar heroes. And many of them came to me too late, confused, frustrated, even ashamed, because nobody told them the truth. The habits they gave up, the routines they dismissed were actually their best defense. And in this video, I want to help make sure that doesn't happen to you. I'm going to show you the 4 major health consequences that occur when older men stop masturbating completely, and more importantly, how to reverse or prevent them. These aren't gimmicks. These are simple, science-backed steps that thousands of my patients have used to preserve their energy, protect their sexual function, and avoid costly medical treatments. And I want you to watch until the very end, because the last consequence I'll share isn't just physical, it's psychological, and it's the one most doctors never bring up. Yet it's the one that destroys more lives in silence than any disease I treat. If you care about your health, your confidence, and your independence, keep watching. And if you're with me right now, if you're still curious, still open, type 1 in the comments. If you're skeptical, type 0. Either way, I want your voice to be part of this. No shame, no judgment, just truth. So, let's begin with the first and most misunderstood consequence of cutting off sexual activity in old age. It starts with a question I've heard from hundreds of patients. Why did my erection suddenly disappear? A man in his 70s sits across from me, embarrassed, confused. He says he hasn't had a natural erection in 6 months, maybe longer. He thought it was aging. But what really happened was more mechanical than magical. He stopped using that part of his body, and the body adapted by letting it wither. Let me be blunt, your penis is not a passive organ. It requires regular blood flow, oxygen, and nerve stimulation to stay functional. It's no different from a muscle. When you stop using it, the blood vessels begin to constrict. The smooth muscle tissue starts to harden, not in a healthy way, but in a way that leads to fibrosis, scar-like stiffening of the tissues. The nerves become less responsive, and over time, the body simply says, "We're not using this anymore." So it stops maintaining it, and this happens slowly, quietly, no flashing signs. One morning, the usual stiffness is gone. A few weeks later, even fantasy doesn't create a response. Eventually, the problem becomes resistant even to medication. I've had men break down in my office, asking me, "Can I fix this?" And my answer is always the same. It depends how long you've waited. Some men can regain some function with therapy and medical intervention. Others can't because they waited too long. They thought abstaining was noble, but their body interpreted it as permission to shut down. This isn't about being addicted to pleasure. It's about preserving circulation. It's about reminding your body that this function still matters. Engaging in regular, respectful, occasional solo stimulation, just once or twice a week, can keep the blood moving, the tissues healthy, the nerves firing. What you don't use, you really do lose. And in older age, that loss isn't cosmetic. It affects your confidence, your relationships, your sense of masculinity. And in most cases, it's 100% preventable. I've seen proud, independent men fall into shame and silence, not because they didn't care, but because they were never told how much regular sexual function matters for the entire body. But that's only the beginning, because the next consequence goes even deeper. It strikes at your hormonal foundation. And when that starts to crumble, the effects ripple through every part of your life. Let me explain. Most older men don't notice a sudden drop in testosterone. It creeps in. One day they stop feeling motivated. They lose interest in hobbies. They don't laugh as much. Their muscles feel weaker. They nap more often. They argue less, but not because they're peaceful, because they're tired. When we run blood work, what we often find is an accelerated hormonal crash, not just from aging, but from total loss of sexual stimulation. And here's something many men don't know. Regular arousal and release stimulate natural testosterone production. Even in your 60s, 70s, and beyond, when you engage in sexual activity, your brain lights up. Dopamine rises. The hypothalamus sends signals to your testes saying, "Hey, we still need testosterone." That keeps your levels more stable. But when that loop is cut off, when you go months with no intimacy at all, the brain reads that as a signal. Shut it down. This system is no longer in use. And so testosterone levels begin to drop, not gently, sharply. And the result? Men start to feel like they're disappearing. Their motivation evaporates. Their energy tanks. Their body composition shifts. More fat, less muscle. Their bones weaken. Their heart becomes more vulnerable. Studies show that men with low testosterone are more prone to cardiovascular disease, diabetes, and depression. But very few are told that solo sexual activity can help slow this crash. One of my patients, a former pilot, once told me, "Doc, I used to feel like a lion. Now I feel like a ghost." And his labs confirmed it. His testosterone had flatlined. But the good news, with just a few weeks of reintroducing safe, healthy sexual engagement, his mood started lifting. His strength returned. His drive came back. Because testosterone isn't just about libido, it's about life force. And that brings me to the third consequence, one that's often mistaken for something else entirely. This third consequence doesn't show up on a lab test. It doesn't scream for attention. It builds slowly, quietly, until it starts disrupting your daily life. And by the time most men mention it to their doctor, they've already been living with it for months, sometimes years. What's shocking is how often this silent suffering can be traced back to one overlooked cause: prostate congestion, caused by a lack of ejaculation. Your prostate isn't just a bystander in the male body. It's an active gland that produces and stores seminal fluid. That fluid is designed to move. It's not meant to sit there, stagnant, month after month. When you stop masturbating or having sex completely, especially later in life, that fluid thickens, pressure builds, and eventually inflammation sets in. That's when you start noticing things: slower urine flow, discomfort in your lower back or pelvis, that annoying need to pee that wakes you up 3 times a night. As a urologist, I can't count how many older men come to me convinced they have a bladder problem, only to find out they've got an inflamed, congested prostate. In many cases, the solution isn't pills, it's movement, it's release. Regular ejaculation is your body's way of clearing out the system, and when that process is ignored for too long, the consequences aren't just annoying, they're life-altering. Some men go on to develop chronic prostatitis, a long-term inflammation that's hard to treat, painful to live with, and mentally exhausting. Others end up needing invasive procedures just to feel normal again. And here's the kicker: it was preventable. A few minutes of self-care once or twice a week could have saved them years of pain, expense, and confusion. But there's an even deeper danger here, one that extends far beyond the urinary tract. Because when that fluid stagnates, it's not just pressure you're risking, it's your life. A well-known Harvard study, and others like it, have shown that regular ejaculation may reduce the risk of prostate cancer. The logic is simple. Flushing out the gland helps prevent the buildup of potentially harmful substances. But when that fluid is left untouched, month after month, it can increase cellular stress and inflammation, both of which are known contributors to cancer risk. I treated a man in his late 60s who hadn't had sex or masturbated in over 2 years. He said, "I just didn't feel the need anymore." But when his PSA levels jumped, we found significant swelling and congestion in his prostate. He was suddenly looking at a possible biopsy, and all the anxiety that comes with it, all because he thought intimacy was behind him. That's not aging, that's neglect, and neglect comes with consequences. This isn't about indulgence or lust. This is about medical reality, about honoring the systems in your body that still need care. After 60, your prostate doesn't retire. If anything, it becomes more sensitive, more vulnerable, more dependent on regular maintenance. And when it's ignored, the discomfort isn't just physical. It cuts into the core of how a man sees himself. That's what we need to talk about next. Because the final consequence, the one no one warns you about, can't be measured in milliliters or hormone levels. It shows up in the way you carry yourself, in the way you stop showing up for your life. It's a quiet collapse, one that doesn't happen all at once. You stop masturbating because you think you're too old, or because you haven't felt the urge, or because you're not in a relationship anymore. You tell yourself it's not important, that it's something you grew out of, but something deeper starts to fade. That spark, that connection to yourself, your body, your confidence, it slowly dims, and you don't even realize it until it's already half gone. I've had men look me in the eye and say, "I just don't feel like me anymore," not because of illness or aging, but because they've gone months, sometimes years, without any form of physical release, without intimacy, even with themselves, and over time that absence eats away at their identity. They feel invisible, disconnected, and quietly ashamed, but they never talk about it, because no one ever gave them the language. It shows up in the way they avoid eye contact, the way they stop caring how they look, the way they pause before answering when I ask how they're doing. This isn't just about sex, it's about vitality, about reclaiming a piece of your humanity that's still alive, even if it's been buried. When older men give up self-pleasure entirely, they lose one of the last pathways to self-recognition, to emotional regulation, and to hormonal balance. You see, during masturbation, your brain releases powerful chemicals: dopamine, oxytocin, endorphins. These are the very substances that help regulate your mood, reduce anxiety, promote emotional resilience, and even protect cognitive function. Without them, the mind suffers. Older men who abstain completely often experience depression, apathy, even early signs of memory loss, not because they're sick, but because their brains are starving for stimulation. I've seen strong, intelligent men become shells of themselves, not because of a traumatic event, but because they quietly disconnected from their own bodies. And here's what makes this so dangerous. They don't know why it's happening. They never connect the dots between their emotional numbness and their decision to stop engaging in physical intimacy. And by the time they feel the impact, the damage is already growing. To reverse it, it's not just about testosterone gels or supplements. It's about rebuilding trust with yourself, about remembering that even at 65, 70, or 80, your body still longs for connection, still deserves care, still responds to pleasure. That's the truth that breaks my heart the most, because it's the one that steals a man's dignity without him ever realizing it. It takes away his calm strength, the quiet pride he once carried. But here's what I need you to know. It's not too late. I don't care if it's been 6 weeks, 6 months, or 6 years. That energy you thought was gone, it's not gone. It's dormant. And in the final part of this video, I'm going to walk you through exactly how to wake it up again, step by step, with real science and zero shame. These are tools I've used with hundreds of patients, tools you can use today to reclaim what so many men have lost. Because there's a lie we've told our elders, that desire, pleasure, and intimacy are only for the young, that past a certain age, a man's body is supposed to go quiet, that letting go of that part of yourself is noble. But after more than 30 years of treating men in their 60s, 70s, and 80s, I can tell you that lie is stealing your health, your confidence, and your identity. Today, you've heard how stopping masturbation can contribute to the breakdown of sexual function, the drop in essential hormones, the swelling of the prostate, and the invisible emotional erosion that takes years off your life. And the worst part? It's not aging, it's inaction. But the good news is, your body still remembers. Your brain still responds. Your health is still waiting on you to step up and say, I matter. This isn't about lust. It's about life, about claiming the right to feel whole again, to reconnect with your body, your mind, and your worth. If this message stirred something in you, type 1 in the comments. Let me know you're still here, that you're still listening, still learning, still fighting. If it didn't speak to you, that's okay. Type 0 and tell me what you need. Either way, you're not alone, and we're not done yet. Now, let's talk solutions, because it's not enough to just understand the problem. We have to do something about it. And the good news is, we can. You don't need expensive treatments. You don't need a prescription. And you definitely don't need to wait for permission. The first step is the most powerful. Start small, but start now. If it's been months or years since you last masturbated, don't worry. Your body doesn't forget how. It just needs a little nudge. Start with intention, not pressure. Set aside time where you feel calm, unhurried, and most importantly, free from shame. This is your time. You're not doing something dirty. You're doing something healthy, something human. Don't expect fireworks right away. You're rebuilding a bridge between your brain and your body, and that takes time. Focus on sensation, not performance. Reintroduce touch. Experiment with what feels good, and allow yourself to be curious. This is where healing begins, not just in your prostate, but in your spirit. Second, rethink your routine. You brush your teeth daily, right? You take your meds, drink water, eat on time. Why wouldn't you also care for your sexual health the same way? I recommend masturbation or ejaculation at least 2 to 4 times a week for older men. It's not excessive, it's therapeutic. You're not just releasing fluid, you're releasing tension, reducing inflammation, and improving blood flow. And here's something many people don't realize. This habit supports your cardiovascular health, your mental clarity, and your hormonal balance. Regular ejaculation has been shown to improve sleep, reduce stress hormones, and even support healthy testosterone production, which can help with mood, bone density, and libido. This is a full body upgrade. Third, pair physical touch with mental engagement. Don't zone out. Be present. That's what keeps the brain-to-body pathway alive. And for men who feel disconnected or numb, I often recommend a combination of sensual self-touch and guided breathing. It may sound simple, but it reawakens the parasympathetic nervous system, the one responsible for healing, digestion, and deep relaxation. Now, let's address the elephant in the room. Some men feel guilty about this, maybe because of cultural values, past relationships, or shame from childhood. But here's what I want you to know. You don't need anyone's permission to care for your body. This isn't betrayal. This is restoration. You're not doing something wrong. You're doing something wise. And for those in relationships, self-pleasure is not the enemy of intimacy. In fact, it often enhances it. When you stay in touch with your own desires, you're more present, more confident, and more connected in any romantic situation. Self-care and shared connection aren't opposites. They support each other. Fourth, support your body nutritionally. A congested or inflamed prostate responds well to anti-inflammatory foods. Include more leafy greens, healthy fats like omega-3s, and reduce sugar and processed food. Stay hydrated and consider supplements like zinc, saw palmetto, and pyjum after speaking with your doctor. You're supporting your gland from the inside out. Fifth, get moving. Physical activity, especially walking, pelvic floor exercises, and yoga, can dramatically improve blood flow to the prostate and lower abdomen. It also helps with mood, stamina, and self-esteem. Even just 20 minutes a day can shift your energy and help your body reawaken its natural rhythms. Lastly, and maybe most importantly, talk about it. Even if it's just with yourself, in a journal, or with a trusted friend. Breaking the silence around male intimacy after 60 is one of the most healing things you can do. The shame loses its power the moment we shine light on it. And trust me, you are not the only man dealing with this. Not even close. I've helped men in their 60s, 70s, and even early 90s reclaim their connection to their body and spirit. And every time, the moment it clicks, they say the same thing. Why didn't anyone tell me this before? Well, now I'm telling you. You are not broken. You are not done. You are not too old. You're just waking up. So here's what I want you to take away today. Masturbation in old age isn't a dirty secret. It's part of your health plan. Just like movement, nutrition, and sleep, when you stop, your body reacts, not out of punishment, but out of imbalance. And when you start again, it thanks you in ways you didn't even realize you were missing. This isn't about indulgence. It's about integration, wholeness, permission to feel, to enjoy, to come alive again. If this message stirred something in you, leave a comment, share your thoughts, type, "I'm still here" in the comments if you're ready to honor this part of yourself again. And if you're not ready, that's okay too. Just know you're never too old to reconnect. This is Dr. Sophia Jain, and I'm honored you spent this time with me. You deserve a body that feels good to live in. You deserve the joy of being fully human at every age. Don't let silence steal your vitality. You're not alone, and you're not done yet. Until next time, take care of yourself, every part of yourself. You matter.